Chapter 11 in your Applied Pharmacology book covers all the medications that we use with skin. We're going to go through skin anatomy and physiology again, talk about topical antiseborrheics, topical antipruritics, fatty acid supplements, astringents, skin antiseptics, and exhibit a basic understanding of wound healing. Reminder, the skin is 3 layers: epidermis, dermis, and this is the dermis, the big part, and then the hypodermis or subcutaneous tissue. The epidermis is replenished every 3 weeks normally. So if we have normal shedding of the cells, that's called desquamation. If it's excessive, then we have scales or dandruff. It's normal to have microorganisms that prevent pathogens on your skin. So there's normal stuff, but if they go away, you'll have more pathogens on your skin. So that's the epidermis. The dermis has a thick layer. It has stability and flexibility. It acts to maintain and repair the skin. The hypodermis has fat and connective tissue. It provides padding and insulation and energy storage. The skin also produces keratinized structures like nail, horn, nasal pads, and foot pads, and hair grows from follicles in the dermis. Dogs and cats have lots of hairs and follicles associated, and they have a lot of hairs per follicle. So not just one hair per follicle. They have associated glands in each follicle as well, so sebaceous glands, and erector pili muscles in the follicle so that they can erect the hair. The follicle can have bacterial, fungal, and demodectic or parasitic infections. If the follicle loses the hair and becomes plugged with sebaceous material, because here's the sebaceous gland, that is a comedo or blackhead. There are 3 stages of growth: anagen, telogen, and catagen. So, topical antiseborrheics. So if our seborrheic glands or sebaceous glands are producing too much of the exudate and it comes out on the skin, they will be greasy and waxy, and then they will start to have some skin issues. They can also be pruritic as well, and it can trap bad bacteria, bad funguses in the area, causing problems. So the first thing that we'll see as an antiseborrheic, these are keratolytics and keratoplastics. Anytime we're using a topical ointment or a topical medication, we want to clean first with a regular shampoo and then lather this material or product and leave it in contact with the skin for 5 to 10 minutes. That's going to allow it to do its work. The first products contain sulfur. They do some mild follicular flushing, but they don't degrease. They're antipruritic, antibacterial, antifungal, and antiparasitic. They are non-irritating, non-staining, and safe for cats. Not all of these products are going to be safe for cats. They can be irritated if we're using excessively or for prolonged treatment, so we don't want to use it for routine bathing. So this sulfur products will actually help to flush out those follicles. So if we have a sebaceous cyst, this is something we can actually do to help flush that out. Salicylic acid, like Sebolite or Kerasol gel, is used with sulfur for seborrhea sicca, which is dry seborrhea flakes. It also treats hyperkeratotic skin, so skin that produces a lot of dead skin cells, those disorders, and also it's used in otic preparations. By the way, if you haven't guessed, the sulfur products do smell like sulfur, so they're not pleasant. The salicylic acid, when used with the sulfur products, are typically keratolytic, antipruritic, and antibacterial. We don't often see any problems with cats and any side effects. Coal tar. It's a very strong sulfur product. It is irritating, it stains, but it does treat seborrhea sicca very well. It's keratolytic, keratoplastic, and mildly degreasing, but it is toxic to cats. Benzoyl peroxide. Benzoyl peroxide is a common thing that we use in our own skin. It treats seborrhea oleosa. What is seborrhea oleosa? It's a greasy skin, a greasy seborrhea discharge. It can also treat hot spots, skin fold dermatitis, deep pyoderma, superficial pustular dermatitis, superficial folliculitis, Schnauzer-Komedo syndrome, tail gland hyperplasia, and stud tail. It is follicular flushing, so it gets rid of those comedoes, keratolytic, antipyretic, and antibacterial. There is a hypersensitivity in some humans. It is safe for cats, but it may bleach colored fabrics. Again, it's a peroxide, so it does have a bleaching effect. Selenium sulfide dries eczema and seborrhea. It is keratolytic, keratoplastic, and degreasing. It also is antifungal. We might get a rash or irritation after use. It could stain, and we do not want to use on cats. Now, I do have a list of products for you here. Oops. I actually need to go back to my show. I just wanted to stop that. Okay. So I have a list of products that treat which diseases. So I have sulfur, salicylic acid, coal tar, benzoyl peroxide, chlorhexidine, and hydrocortisone. What are they? When do you want to use them? And what therapeutic products are they in? So this can be really helpful to you as you're remembering things. Some topical medications mixed with water are used in baths or can be applied with compresses. Domiboro, which is aluminum acetate, used in cool water soaps to prevent exudation and can relieve some inflammation, exudation that results from inflammation, and it can be used to relieve itching. It's drying, astringent, and mildly antiseptic. Uncommon to have side effects. Epsom salts or magnesium sulfate produces a mildly hypertonic solution, so it draws water from tissues, and we use it for wet dressings. So again, very uncommon to have some side effects from that. Bath oils can be used for dry skin, seborrhea sicca, and to normalize keratinization. So we want to leave these on. When we're using bath oils, we want to leave these conditioners on the skin and the hair coat. Some topical non-steroidal for relief of itching and discomfort would be colloidal oatmeal or pomoxine hydrochloride. These are safe alternatives to steroids, or we can use topical steroids like hydrocortisone, triamcinolone, fluocinolone, and betamethasone. These give us relief from itching, burning, and inflammation. If we have hot spots, allergic dermatitis, causes of that. So we do have to be careful if we have Demodex, obviously, or diabetes. And we often see these in combination with antimicrobials and astringents. Astringents have little penetration. They don't really get into the skin. They act to precipitate proteins. They contain tannic acid or iodine or alcohol and phenol. They're used to treat moist dermatitis and weeping skin wounds. They can toughen the foot pads of dogs, but they may cause irritation. So here's an example of gold label veterinary wound powder and antibacterial and astringent powder for application to minor cuts and grazes. So this one has chlorine in it, and this is typically used for horses. Some antiseptics we might use to inhibit bacterial growth and clean and treat wounds. Now remember, anything that we put on a wound could potentially delay healing. However, there are times when we really need to clean the wound. So alcohols are bactericidal, astringent, cooling, and erubefacient, meaning they bring redness, or they open up the vascular, they bring red to the tissue. They can cause, they bring red to the tissue because they're vasodilative. They can cause irritation of denuded skin surfaces, meaning abrasions or things that, like if you have cuts, I'm sure you figured that out. Propylene glycol is antibacterial and antifungal. Concentrations greater than 50% are keratolytic, and it's also a solvent and vehicle for other drugs. We might see erythema, so a reddening of the skin, if they're at greater than 50%. Chlorhexidine is a common cleaning solution that we use as a bactericidal, fungicidal. It's effective against a lot of viruses. It's non-irritating. If you're using the solution, not the scrub. When you use the scrub, you're adding some basic components to it, and that can be irritating. It's not affected by organic debris, and it is safe for cats, so it's something that we can use to clean wounds not near the eyes. So remember, it causes corneal ulcers. Acetic acid is used in otic preparations, and it is For superficial Pseudomonas species infections of the skin and ears, it's uncommon to have any adverse effects. Iodine is used as a bactericidal, fungicidal, virucidal, and sporicidal. It's betadine solution. It is irritating and sensitizing, especially in cats. Most products will stain. It is something that if we use in a 50-50 solution, is safe to put in the eyes, so we can use it around the eyes. Benzalkonium chloride is antifungal and antibacterial, but it's not effective against Pseudomonas species, and we have to remember that soap and other anionic compounds will inactivate it. It does have a toxicity in cats. It's not approved for food-producing animals. As a quick review for wound healing, we start with the inflammatory or lag phase. Inflammation brings in all the healing aspects. Okay, so we get bleeding, which brings in inflammatory cells and factors and our clots. And remember, our neutrophils are our first responders. Then we have the debridement period where the macrophages eat dead, used up neutrophils and remove debris. That starts at about 6 hours post-wound. At about 3 to 5 days post-wound, we're starting to get repair. Collagen is deposited, granulation tissue forms, and then after 5 days, we get maturation where the wound starts to heal and consolidate and strengthen. Some of the healing factors that we need to be aware of: age, nutritional status, rest, environment, and general health. Most importantly, need to remember that nutritional status is very, very important. Without bringing in new protein, we cannot heal wounds. Wound factors. If we have a contaminated wound versus a non-contaminated wound, that's going to slow the healing. It's actually going to stop healing. If we have external factors, so infection stops healing, external factors, temperature regulation. If we bandage it, keep it a little bit warmer than usual, actually will improve healing. If we have cleaned it out, that's going to help. Wound closure. Do we have a primary closure? Are we allowing it to granulate in and close that way so we don't have a closure? Or are we doing a tertiary closure where we're allowing it to granulate in, and then we may cut some of it away and then close it as a primary closure after that? There are some healing stimulators. Now, most things will keep animals from healing. There are a couple of things that will allow wounds to heal a little bit faster, but most topical wound dressings, ointments, solutions, gels, creams, lotion, sprays, powders, dressing sheets, most of them delay healing in some way. They may clean the wound and therefore allow more quickly for it to heal, but if we have a clean wound, then it's best not to use a lot of stuff. Some healing stimulators would be scarlet oil, zinc oxide, Caravet wound dressing, Biodress, and Colamend, adding collagen to the wound. The best, most natural wound healing is actually honey. Honey has antibacterial, antifungal properties, and it helps to soothe wounds and stinging. So honey is something we can put on a wound and actually increase healing. Now you got to make sure the animal doesn't lick it off, obviously. Some wound cleansers that we can use to lavage prior to the wound dressing, especially if we do it with warm water for more than 15 minutes, can help to remove necrotic and purulent exudate. It could sting, so be careful. Warm saline can really be the best thing that we use to cleanse the wound, but we can use Eau-de-Cleanse, C-Stat, Intracell, Dakin solution, which is a 0.5% solution of bleach, and Granulex V. Some protectants that provide a protective environment from irritation and act as a barrier would be dermal wound gel, Thuja zinc oxide ointment, Nexaband, Tissue Mend, and No Sting barrier film. Some other drugs we use with the skin: systemic corticosteroids, dexamethasone, prednisone, prednisolone, Depomedrol, Betalogue. Those help with allergic reactions like fly bite sensitivity or flea bite hypersensitivity, atopy, moist dermatosis like a hot spot, seborrheic dermatitis, and acrylic dermatitis. But we have a lot of side effects. So PUPD, polyphagia, we do need to warn the owner that they're going to be drinking a lot. They may pee in the house. Also weight gain. As polyphagia can lead to weight gain. There are a lot of problems with it, but that's usually due to misuse or chronic use. Some topical antibacterials like Bactoderm, nitrofurazone, gentamicin, Prodein, those help with the treatment and prevention of superficial bacterial infections and wounds, sometimes combined with antifungals or steroids, and usually you have to use that 2 to 3 times a day. It's important to clip the hair first. If we remove the hair, which will bring moisture, hold moisture in and bring bacteria and stuff to the wound, that will leave the wound cleaner. Some topical antifungals include Conifite, Panalog, iodine, and copper tox. Copper tox is actually a copper solution used for the treatment of thrush and equine. But these are for superficial fungal infections. We use these 2 to 3 times a day. Want to clip the hair, use iodine, and if we're using iodine and copper products, realize that they're going to stain clothes, skin, and hair. Fatty acid supplements, derm caps, EFA caps, any fatty acid supplement that you might use for joint control or joint supplements. These can help to control itching, improve skin and hair, inhibit prostaglandin formation in the skin, and are synergistic with antihistamines or glucocorticosteroids, so they can make those work better. Using those can really strengthen and heal the skin very quickly. Linoleic amino acids are essential for dogs, plus arachidonic acid, which is essential for cats. But we have to be very careful that with vomiting, diarrhea, and some increased bleeding times. Some other drugs we might use on the skin. Counter irritants are liniments and braces. These are tighteners, or they're also called sweats. These are applied to the skin of horses to produce local irritation and inflammation. This treats chronic inflammatory conditions of bone, joints, ligaments, and tendons or other tissues below the surface, because it creates an acute inflammatory condition to promote blood supply to the inflamed area and adjacent tissue. We need to massage. We have to be very careful. Overuse can be irritating. If you underuse it, it won't have much effect. It can cause vesication or blistering, which is where we have separation of the skin layers, the epidermal layers. To cause vesication, if we do need to cause vesication, we use mercuric oxide or cantharide. It causes severe irritation accompanied by capillary damage, which leads to blisters. It can be used to treat chronic inflammation of musculoskeletal conditions of the horses, but it causes skin disease. This is called blistering, not necessarily something that we recommend. We do use caustics, however. Copper sulfate, silver nitrate, caustic powder destroys tissue at application site. So if we have proud flesh or superficial tumors or warts or horn buds, we want to remove that extra tissue. This caustic powder will be helpful. But we have to be careful of any damage to adjacent tissue, especially in the eye if we're using it on horn buds in cattle. Some other miscellaneous drugs we use for skin include behavioral drugs. Cats and dogs can damage their skin by licking or chewing on themselves, and this can be due to behavioral issues. Feline psychogenic alopecia and canine acral lick dermatitis. Tricyclic antidepressants are potent H1 histamine blockers that also inhibit the uptake of serotonin and norepinephrine. So they do help with the itching and also the behavioral component that leads to these diseases. Phenobarbital can be helpful in deadening the nerve endings, as does gabapentin. Diazepam can help with anxiety. Amitriptyline also helps with anxiety and deadening the nerve endings. Fluoxetine is Prozac, and then naloxone or naltrexone is an antagonist, an opioid antagonist that at low doses can be very helpful. There are some adverse effects: sedation, idiosyncratic fatal hepatic necrosis in cats, dry mouth, hypersalivation, vomiting, constipation, urinary retention, ataxia, disorientation, depression, and anorexia. We may have to use some selective immunosuppressors if we want to suppress part of the immune system, like an allergic reaction, but not the whole thing. Cyclosporine A treats atopic dermatitis. It's a cyclic polypeptide that acts specifically on T lymphocytes. So it's anti-inflammatory and antipyretic, but doesn't necessarily completely destroy the immune system. There are some adverse effects, GI disturbances. They're typically mild. but they may continue. Rarely we might see muscle cramps, muscle weakness, anorexia, gingival hypertrophy, varicoform lesions, which are like little warts, and then changes in the hair coat. So we'll watch for those. If you have any questions about any of the products we talked about with skin diseases, please bring those up in class.